introduction, I mentioned the rotation elements that happen at the shoulder and the hip, and kind of just assume that people will tend to get kind of stuck in this externally rotated and kind of lordotic pattern. This is one that's pretty common. There are exceptions to this, but this is pretty common, like weak core, kind of stuck like this, and kind of having more of a penguin. Yeah. So duck-footed penguin, and spet in here. And if you do this, if the low back gets truly tight, weak core, tight lumbar, rector spinae, stuff like that, and that would include also with this weak glutes. You end up with a shorter gait, kind of more of a wobble, and then just that. Now, there's other versions of kind of getting stuck more in a kyphotic phase and stuff, but what have you. Seated positions and slouching can also, it's just, but if we can help a person at the hips, return more here, and in this orientation, part of what gets lost is what's actually short is here and here at the hip flexors. So with the legs, another way to think about this is somebody always stuck in a seated position. That the hip flexors are short, the knee flexors are short. They may have symptoms here and here, but these are long structures. They've been held long and they maybe have become weak, but the things that we can help the most are going to be related to the shortened stuff. Same thing occurs with the foot. We tend to get too tight in plantar flexion and inversion. We help into version and dorsiflexion. The shoulders, as a real simplification, everybody gets stuck in a sling, especially when there's been an injury or some symptom manifestation here. That the patterned, safest place to position the shoulder for your artery and your nerves to have the most clearance here is to do this. And so it puts the shoulder joint here, the ball and socket joint, kind of more of what's called a loose pack position, where just the bony ends are separated from each other. That's why slings work good. And then they hold you out of gravity, and that makes it even easier for us than us doing it for ourselves. But your muscles in your body will artificially do that. Included with the sling, though, is the shoulder elevation piece. So assuming that everybody is stuck with their scapulas up, elevated too high, and then shoulders rolled forward. And there's two things to happen with this shoulder rolled forward manifestation. One is the ball and socket joint internally rotated like this. But the other is what's happened to the scapula. The scapula can protract, where it rolls over the ribs, like that. And then when it elevates versus depresses. So scapulas for people tend to get stuck in an elevated, protracted orientation, especially the dominant arm or the injured arm. So the nice thing is what we need to lengthen is here and here. The added benefit can be when we're starting to get into muscle energy technique territory is inhibitory pressure by itself is sending a signal to the tissue through just a mechanical stress that lengthens. Whatever I push on, doesn't matter what it is. It could be clay. If I squash the clay, what I squash on is going to get displaced. So we're mechanically changing the shape of it and hoping that the nervous system picks up the signal and goes, oh, that's right, I'm supposed to be like that, not like that. So it's reminding the nervous system what the ideal balanced muscle tone is. So if we incorporate, I am sending a signal that, hey, I want you to lengthen via inhibitory pressure. When a person then tries to shorten that, the body's going to have a harder time accomplishing that because I'm holding those fibers down. I've displaced them and I've pinned them. So when they try to shorten, that's a struggle. Thus, we will get a shear effect on those fibers. Like I've already squashed them, and then they're kind of trying to shorten, and then they're going to let go. And we can do just a contract, relax, that would be called. I squash it, and then they contract it, concentrically shorten it, and then let go. If I have them do the opposite movement that would that would actively lengthen it. Because if I do this action, both of those I'm doing it via responses of the nervous system. I'm telling these muscles to shorten. I'm telling these muscles now to shorten. As this is occurring, these need to lengthen. And as this is occurring, these need to lengthen. So both need to coordinate, a shortening effect, and then the antagonist on the other side, a lengthening effect. So when we're dealing with, like this is an easier example, where if these are too short and these are too long, and the way I can balance this is by telling these to reduce in tone and these to increase in tone. Physical therapy predominantly assesses what is too long, what is weak, and has you exercise that to balance it out. So they'll see that this is where you're trapped, and then they'll say, okay, do tricep exercises, and that's how we will balance this out. We can do the added thing of inhibitory pressure and then activate in both planes, but it's going in the opposite direction and activating the antagonists that can be the big next piece to really getting something to change. Because what this area, or in his case, this area needs to be reminded of how to do is eccentrically lengthen. So inhibitory pressure, then concentric shortening, then eccentric lengthening. Now what we've done is send two signals via my compression and the difficulty of being able to shorten it. We're telling that particular muscle or muscles to lengthen, but the stuff we're not pushing on is being told, well, you're not being made to have a hard time. So the impression should be, you activate more, you activate less. And that's contract, relax, antagonist, contract. And there's other ways that people make fancy terms to try to call that something else. There's all kinds of weird branding around muscle lunge techniques and stuff, right? But really it's inhibitory pressure plus concentrically contract, relax, antagonist contract, which then causes what I'm pushing on to eccentrically lengthen. And that's in a nutshell where you would get the most value out of an active movement thing, is you find what's short and then start playing with these muscle lunge techniques based on what the client's capable of pulling off and all that kind of stuff. So if a person has an elevated scapula, then what I want to do is teach it to not be elevated, but to be depressed. It's the good version of depression. There. So I'm going to set him up here. Since we're on the topic, I'm just going to focus on a couple really valuable muscle lunge techniques that I will forever tell you to never forget, because these will probably be the ones that you can use the most to help people with a variety of issues, whether it be neck, shoulder, or low back. So here, I have to have the arm on the side of the table. You're going to learn a different set of applications that are closely aligned with muscle lunge techniques, whether they're about muscle activation sequences or firing patterns. Those are different than just thinking about chains of muscles and how they work together. That's in the future. This is talking about what I think is one of the most valuable things you can do for just better scapular posture. And how do you do it? All I have to tell a person, and one thing about this too is, how do we explain to a client what action to do so it's not overly confusing? And that's what's nice about this one. Now, I have to figure out a way to apply a force that a person can push against. So both of these have the added value of not requiring you to figure out a lot of where to position your arms to create that resistance. Usually you're going to be pushing in a place that's already creating the resistance, or you're not going to have to be somewhere doing that. So if I'm just here and doing everything that one knows after doing this, you have a sense of kind of where to apply pressure where you're getting as many structures at once. And so what I'm trying to be on is two muscles, upper trapezius and a muscle called levator scapula, which guess what levator scapula does? It elevates the scapula. So I want to be on those two, and then here's my point of resistance, but I'm already applying resistance to scapular elevation because I'm pushing down. I'm not directly on the scapula, but that's one of the reasons why this works so good, because you as the therapist don't have to work so hard. All right, then all I have to say to a client is, okay, shrug your shoulder a little bit, okay, hold it, and that's all it is. Not all it is, I'm sorry, there is more. Okay. Now holding for ideally close to 10 seconds, slowly let go. That would be just the contract, relax, okay? Now let's add the next piece. Okay, go ahead and push, hold. Good, keep holding, keep holding. Okay, nice and slow, back down. Now I want you to reach for your toes, look for a stretch. They're in control. Good, slowly let go. Relax, back to full. Okay, push up. Hold. Now let's combine one more cool thing. Okay, take a big deep breath. Okay, and as you exhale, just relax, and then reach for your toes. And you're good, let go. Anywhere in the shoulder-ish region and neck, many of these structures get activated related to breathing because they're pulling the scapula up to make more room for the ribs, or they attach directly on the ribs. So there are neck muscles that attach onto the clavicle, or they attach onto the first two ribs, and they get tight, related to upper chest breathing. So you can use breathing plus a movement of the joints of the body and get even more of an effect all at once. So again, let's look at it doing it this way. It would just be here. I have to be posterior. I'm looking to be right here. Levator scapula attaches on the superior angle of the scapula and goes to the base of your skull. Upper trapezius, the belly of its muscular structure is right here. It has larger elements where it comes from the base of the skull, comes down. The bulk of it right there attaches here, and then comes all the way down like a trapezoid, like the lower mid-thoracic region. This is a case where upper trapezius and lower trapezius are antagonists, because lower trapezius is what's supposed to shorten to pull the scapula down into depression. So that's the signal that we've sent. Hold. I could pick a lot of options of how to do this. The forearm works the best for me because I feel like I can get a bit more posterior with more pressure. But if I had a smaller person, maybe I could find a way to be on that area more targeted like this. And I'm here, a shrug, hold, big deep breath, and then all the way out, and look for the stretch, reach. Now when you feel this, I'll tell you what, that's where you get the wow factor in terms of intensity for a client. Relax. This is a pure relaxation session. I probably wouldn't be incorporating this, right? But somebody really wants that to feel better, like they have more mobility, that they don't have a monster living right there. It's not going to be the shortening element, it's going to be the reaching. And they are in control now. They can challenge that and be as aggressive as they want. And I could go further. I could have him push his head down into the pillow and do a big like that to even more exaggerate this. But right here, you're getting 2 for 1. 2 really important muscles related to a distortion that just basically every human gets trapped in. our shoulder blades get stuck to our ears. So we exaggerate the distortion while we push on the thing and then have them reach for their feet. And it's a big win. All right. Same thing here for the low back. Oh, let me get you tucked a little bit better. Here at the lumbar spine, I had some anatomy posters, but the nature just how much comes together back there doesn't really do a whole lot of justice. But regardless, I'm trying to be right there. There's just so much there, and then the idea is that we can continue to track further back, depending on where the source of the problem is. And then we can rely on their feedback. Hey client, does it feel like I'm more on the stuff bothering you here, or here? And you gotta tell me. Now ideally I'll feel it, but if we really want results, we need that immediate feedback to help guide us. To this day, that's how I function. I may have a good sense of what's going on, but I come through here and I make them be a part of it. I'm like, none of this is gonna be especially relaxing. So I just am like, we gotta feel, okay, does that feel like more of the thing? Does that feel like more of the thing? Or does that feel like more of the thing? And anywhere in between all of that. Now, any one of those, you have a person with a low back thing, what you have to find is a way to get on that structure, hold a nice stable compression. If you notice even here, there's no fancy movement technique. I just have to have such good body mechanics that I can hold that compression for a long duration. So the fancy technique for me is a sustained, stable compression. Then here, same thing. And then all I have to do is ask the client to lift this bottom leg a little bit. So go and straighten your leg a little bit, Logan. Just so you can see the degree of how much actually has to happen here. So just start to lift. It doesn't need to be, it can be even less than that. It has to be enough to just cause these inner thigh muscles, the adductor group, to activate, and that will cause a co-contraction here. So we can create a muscle lunge technique for the muscles of this lumbar region without having a person actually move in such a way where they're stressing the spine directly. So my dad had bad spinal fusion, and that was a really hard journey of how to work on that from a really terrible car accident. The only way that could be facilitated is this. Now you wouldn't do this prenatal, right? Don't do that. That's silly. You could work better though like this. You can be right here, working adjacent to the SI joint and helping just kind of soothe that. It's gonna be a bad time regardless, but I wouldn't work laterally in that case. But everywhere else, I would probably avoid the forearm in that situation. I'd be doing stuff like this. But it doesn't matter where I'm at. If you watch my hands, we're gonna go ahead and lift your leg up a little bit. Kicks on. Okay, lift your leg up, kicks on. Can't miss. Isn't that neat? So it's a really good go-to, and it's incredibly safe, and because of the nature of them using this opposite leg, it's very easy for a person to do. These muscles are really big, so the effort to do that is very small. It could be the tiniest, most delicate, frail thing you can think of, and this is an action that shouldn't feel hard to do, and it's easy to describe to them when you're asking them to do it, because I just push here, ask them to lift their leg, and if you don't feel the kick on, they're not doing it right. And that's that. All right. Restarting. Head squishes. I'm going to try real hard to shut myself up and go into just what this routine would look like. And to march around. You'd be amazed at once you figure out how to do this well, how incredible a good skull squish can be. And we're good there. Here. Arm everything just superficial stuff. So these first applications, although I have like some clear intention related to the anatomy, I'm usually initially just thinking that superficial fascia. Get that first layer nice and warmed up, then we'll come in. If I stand more behind the head, then that's going to direct the force away from the spine. If I stand more in line, then I have to figure out what I'm going to do. I'm either going to go just right in and stop and hold a stable compression, or I could do just a little bit, but look at how big this is going to be. I'm slowly gliding, slowly gliding, slowly gliding, and then that'd be about it. That was a long duration glide that maybe was, what, an inch? And switch. As long as you make sure you're standing behind the head, your force is going to be pulling the tissues away from the spine. Thus, it's going to be very safe. You just gotta start cautious, and as you just build out your awareness of the anatomy and can palpate, you'll get there, I promise. Now, we already did all the muscle energy stuff for the upper trap area. Here. Go right to the base of the skull. If I increase my elbow angle, that'll take me more posterior. If I flatten my arm out, that'll take me more lateral. Good, and done. Then I move towel. Where's that purple sheet? You're not draped appropriately. Where's that purple sheet? Yeah. All right. Bad draping exercise, Logan. Yeah, the sheet down here. So there we go. How we would have wanted one setup, head up, tucked under, arm out, voila. Here. Then we'd be at that part of the routine right there. Set, arm, drape. Let your arm just come right down. There we go. And there we go. Practice this as best you can, whether you hold the arm or just let it sit right on top of yours. But I am so used to this frustrating the living daylights out of people for a few months to find a way to kind of navigate around that scapula. So just, you've heard me say it's going to be annoying, so go be annoyed. It'll be okay. This is a very important structure to be able to work on. And then in time, I'll show you some cheats. But you're never going to do better with being able to figure out how to work there, because that naturally transitions very nicely to going into this low back setup. Other options for the shoulder in this position are here. Arm underneath. And you can just roll. If this could be a way where I could at least affect the latissimus dorsi, it's not going to be quite as targeted and perfect. And look, I'm having to hold their arm up. There's just more variables I have to keep in control, but it works pretty good. I can hold the sheet across the front of the chest. And that works good too.
Could you do a shrugging while you resist?
Yes, yep, you could do right. You could be right here. And this one, sometimes people are like, you just have to be a little careful that this is not inadvertently putting pressure on the clavicle. You got to be sure that you're. I don't do a ton of that. I don't do a ton of like these stretches this way. But yes, you could certainly do resisted movement in either direction. Okay. Applications here. Find the top of the pelvis. Dive straight down. Here. And there. And there. Listen however you can. Go. All right. Legs. Scoot back a little. Bunch. Gonna go real fast. So that was adductors, then hamstrings. Just kind of illustrating the importance of the forearm. Calves. Switch. Here I can use palm. If I needed to be more aggressive, I could use soft fist. Cradle the foot, right there. Then, this is a little low for me, but low enough. Go ahead and scoot. There we go. Times when you realize repositioning, that would be not as common for you to have to actually get their foot more on the table, but there you go.
Did you have extra long tables for the pistons?
No, I just made it work. And
Question.
Yeah, they must have been
Yeah.
all over.
For sure.
yeah, no, I mean,
Thought of that.
tend to, that's where the value is sideline because of the ability to reposition more like this. Here. The trainers' tables were a little bit longer, but they didn't like often have face cradles and stuff like that. And not that I would ever usually suggest it, but sometimes as long as I wasn't applying force, you on the head, and you could leave the face cradle on and have them just, that would at least push them up a little bit. But I worked usually with the biggest that you could deal with the most, and I was able to make a regular size table function just fine. It was harder with the really giant football players who actually are not as tall, but are just, enormous and thick. So the really big Lions guys were actually way more of a struggle. And there were a couple of them, like the really big linemen, that I had to put on the floor and learn how to work. And that you will learn. You'll learn a bit more with somebody that's a touch more specialized in it, Kylie. But I did a lot of floor work. There was a stretch where we didn't even have space on the little jet to bring an extra table. So I didn't have a table to use at the hotels, and I would just have to create a table out of couch cushions and sheets on the floor and just make it work, That was a splash. So now you can see more of that, the pole hook hand, where you can let your fingers be more relaxed. Now that's just going to be more gentle. But the biggest thing I can say for you in terms of reducing how much effort you're doing is to make all of these strokes smaller. Like that's where I stop. And this is all just light to reset. There's the main application. Stop. Main application. Stop. Don't force it like that. Or pick maybe just one hand to do a little bit, but look how I just do. Here, 1, 2, 3, and 4. And I gotta scoot this down just a bit. Here. Dorsiflexion, plantar flexion, inversion, eversion. Since I'm on muscles that do eversion, I'm focusing more on that. It's a case where I wish everything was named adduction, abduction, but it is not. It is a frontal plane movement. At the hips and shoulders, it's called adduction, abduction. So that's your jumping jack actions. But at the wrist, you're called ulnar deviation, radial deviation. And then at the ankle, it's called eversion, inversion. But they're just frontal plane movements. I wish everything was just called adduction, abduction. And there. Done.